We go now to Dr. Walter Koroshetz, director of the National Institute of Neurological Disorders and Stroke at the National Institutes of Health. He's also the co-chair of the NIH's Long COVID Initiative and joins us from the NIH campus in Bethesda. It's good to have you here, Doctor. COVID survivors often suffer some kind of symptom for weeks, if not months afterwards. How do we know that this is attributable to COVID and not caused by something else?
Well, I think, Margaret, a couple of points to make there. The first is that the vast numbers of people who are affected, the fact that the symptoms occurred with the infection and in many cases persist after the infection, it's that temporal relationship that really goes to causality. There are some unusual features, though. Some people get better and then they develop the symptoms back again. It's a little less clear, but given the fact it's happening so frequently after COVID, we expect it is due to COVID. But it is important to mention that we don't want people to just assume that everything they develop after COVID is due to COVID. I think that you really need to see your doc and investigate what your symptoms are to make sure there's not something else going on too.
And what are the symptoms? Because I've read such a broad array, from brain fog to people having difficulty getting lung capacity back. Senator Tim Kaine talked about feeling like he had Alka-Seltzer bubbles on his skin.
Sure.
What is a symptom of long COVID?
Well, I think what you just mentioned is really the great difficulty, is the fact that the heterogeneity of the symptoms is quite vast. But I think there are some characteristics that make it very unusual. People develop usually more than one symptom. There's usually a cluster of symptoms, and they are falling into certain categories. So there are neurologic troubles, like you mentioned, trouble concentrating, sleeping, sometimes peripheral nerve trouble, that sense of the bubbling on your skin. Some people have pulmonary difficulties with continued sense of shortness of breath and a cough. Some people have cardiovascular trouble, a lot of trouble with exercise intolerance. Fatigue is just pretty much, with most of the people who have trouble, have a lot of fatigue issues. There's digestive tract trouble as well. And people tend to have, a couple here and a couple there, but they are all seemingly tied to having had their COVID infection. But it is variable, absolutely.
So the NIH Recover Study was launched in February 2021. You've got about $1 billion or more funding the research you're doing. Right. What have you found in that study, and when will your results be made public?
Well, thanks. Yeah, so the study has multiple different components to it. We have upwards around 4,000 people already enrolled, which makes it the largest in-person study of the post-COVID situation. And right now we're collecting data on the different symptoms, as you mentioned, trying to understand what the different subgroups are going to look like. But we really want to do two things. One is we want to understand the underlying biology that's causing this trouble. This is not a new problem exactly, because there are other infections in the past that have led to similar symptom clusters in people after infection. We've never been able to figure that out. This is our chance, I think, to delve deep and to try and understand what is going on in the biologic recovery and the people who don't make a good recovery. And that being said, the other thing we'd like to do is to understand how to actually attack the symptoms in addition to underlying biology. So understanding the underlying biology could take some time. There's no real good precedent for this, but many of the symptoms doctors have been dealing with: sleep disorder, fatigue, exercise intolerance, and there are medical and non-medical treatments. We don't know which ones work best in the post-COVID situation, but those are the kind of clinical trials that we'd like to get off the ground.
You'd like to get off the ground. So it sounds like it will be a while before you get results. Stat News had been reporting that you were having some difficulty with enrollment, that the study had only enrolled 3% of its recruitment goal as of mid-March. How do you improve that? Why aren't people participating?
Well, there's two things. One is that there's a group of people that we wanted to enroll during the acute stage of the infection, so we could follow how they recover over time and compare those who make a good recovery versus a poor recovery. When the COVID pandemic kind of quelled down, those people were not going to see physicians. They were hard to enroll. The people who were having trouble, what we call people who were already suffering from the post-acute sequelae of COVID, they have been enrolling at a very good rate, actually over what we had put in as a milestone. So we are enrolling quite well. Recovercovid.org is the website for people to enroll in. We have 200 sites across the country for people to enroll in. We need people who had the infection or having trouble, but we need people who did well with the infection that we can make a comparison with. And those are the real heroes, are the people who are willing to get stuck and talk to the docs, get the surveys, get the tests done. But we are looking forward to really bringing in about 40,000 people into the study. The last numbers, I think, are around 4,000. We have groups that are going after to study children, another group going after pregnant women to study, another group adults. We have an autopsy study that's going on to look at inside the body under the microscope and people who happen to die after they've had COVID. We have electronic health record studies in upwards of 60 million people, and some of those have already published kind of incidence, prevalence type data you get out of electronic health records.
Are you suggesting that long COVID can kill?
No, you should make that very clear. The numbers of people who have long COVID, which could be in the million, some of those people will unfortunately die of natural causes, other reasons. So yeah, we don't think it's a fatal illness at all at this point. No instance, no suggestion of that. But some of those people will die of other causes. And to understand what's going on in the body after COVID, you can really get deep down into very intense studies in the tissues that come in an autopsy. And so if anything's going to give us the really quick answers, that might be it.
So at this point, I mean, some of the studies that have been done suggest that 60% of long COVID patients are female, that neurological symptoms can persist for about 15 months or more. The CDC says COVID survivors have twice the risk for developing a pulmonary embolism or respiratory conditions. 1 in 5 has a condition that could be due to COVID. Are all of those things consistent with what you are seeing right now?
I think so. I think some of the data you have to kind of look deep into the details to understand it correctly. But those are data that are kind of coming out now, and I think that they are true. Yes, this is a significant problem for the country going forward. What we don't know is how long it will last. We don't know what the long-term effects, a decade now from what COVID has done to our health in the country. And that's the other thing about Recover, is setting up to really look over the long term. It looks as though right now there's also an increased chance of developing diabetes after COVID. We don't know about heart disease, dementia, all the other diseases that naturally occur either. But that's kind of what we have to get at the bottom of.
And I imagine that means we also don't know if there's any kind of cognitive development issues that result in children who have these infections.
That's also correct, yes. So we have a large study looking at children to go after that question. Right now, though, we have not seen anything of concern, but you have to wait, years to look at neurodevelopment and see how that works its way out in kids who had COVID. That's true.
And before I let you go, just how is it that we are 2 years or more into this pandemic and we know so little? And do we at least know that there are treatments for long COVID?
Well, the treatments for long COVID, the answer is really we don't have like a magic bullet, a cure for long COVID, because we don't understand what's driving it biologically. And so to get that, holy grail, we need to understand what is wrong in the body that's causing these symptoms, clusters of symptoms in people. And as I mentioned, for the other infections that have occurred in the past, we've never been able to figure that out. So there's people with post-infectious mononucleosis, people with post-Lyme, they've been suffering the same things. There's a condition called myalgic encephalomyelitis, chronic fatigue syndrome, that looks almost identical to what we're seeing. And these have existed for decades. We've never been able to figure them out. And yet there are, but I think there are people should have hope because from what we've seen so far, people after COVID, even months after, still are getting better. We don't know how many are going to plateau out and develop a ME/CFS-like picture. But I think that most of the people I talk to say that patients are still improving, although it gets slower after 6 months or so. And then there are ways to attack the symptoms. So if you have a sleep disorder and fatigue, it may be that attacking your sleep disorder can really help with your fatigue. And there certainly are ways of doing that.
So for
it's
some,
kind of targeting the symptoms and targeting the underlying biology, the two main avenues we're going after.
and for someone who's listening to you right now and they think they might have long COVID, what would you advise them to do when they see their doctor? If the doctor doesn't really know where to begin looking, how do you lead your doctor there?
Well, I think just being forthright with your physician and telling him what your problems are is the first step, and not being afraid of it. Clearly, I think the knowledge about this condition is spreading like wildfire across the country. So it's not a brand new thing anymore. And there's actually now a billing code, an ICD-10 code that is being put into the medical records. It's called the post-COVID condition. So it's actually getting out into the general medical practice now.
Doctor, thank you for your research. We will track it, and we know the effects of this pandemic will be with us for some time in many different ways. We will be right back.